My name is Paul Schreiber. I live in Yarmouth, and for the past 12 years I've been the administrator of the Inn at Village Square, a 37-bed PNMI residential care facility located in Gorham. I adamantly oppose the proposed legislation that would place restrictions on Maine care eligibility for PNMI residential care services if individuals' monthly income exceed $1,006 per month. Although I understand that those residents on Maine care already living in PNMI residential care facilities may be grandfathered, if enacted, this proposed legislation will have a devastating and life-threatening effect on those Maine citizens that desperately require these services but will not be grandfathered. I'm concerned about all Maine residents that will be affected by this proposed legislation, but I'll refer specifically to the residents currently residing at the Inn at Village Square. 14 residents at the Inn at Village Square are currently on Maine care. Of these 14, only two or 14% have monthly incomes that are lower than $1,006. Hopefully, they would be grandfathered. Their average income is approximately $1,400 a month. 19 of our residents are currently private pay, 12 of which are expected to spend down their resources and convert to Maine care in 2013. Of those 12 residents, only one, or 8%, has monthly income below $1,006. Their average monthly income is $1,608. By the time they do convert, on average, they would have been residents at the Inn at Village Square for approximately 15 months, and they would have paid approximately $80,000. So they have paid a fair amount of money. If this legislation is enacted, it will restrict these 11 residents with monthly income above $1,006 from converting to Maine care, and thus jeopardizing their continued residency at the Inn at Village Square. Here's a little information about these 11 residents that will be expected to bear the burden of this legislation if enacted. The average age is 87. 4 are currently ages 90 to 95. 1 male, 10 female. All have some level of dementia. All 11 require medication administration. These residents, 11 residents, have an average of 11 prescriptions each, and the average number of med passes that we provide for each resident averages 3 per day. 9 use walkers, 1 uses a cane. All 11 require assistance with bathing. All 11 require some level of personal care, such as dressing, ambulating, and toileting, and so on. All 11 require someone to prepare meals, do their laundry and housekeeping, shop, and transport them to medical appointments. Estimating that their average cost of care, if they convert to Maine care, would be approximately $1,400. Based on the Inn's current Maine care reimbursement rate, the cost to the Maine care system, prior to deducting any amount that the federal government would contribute, comes to approximately $45 a day. So, in summary, it costs the Maine care system approximately $45 a day for an 87-year-old resident with dementia who uses a walker and requires 3 medication passes a day to administer 11 prescriptions, and who requires assistance with bathing, perhaps dressing or toileting, and other types of personal care, meal preparation, laundry and housekeeping services, transportation to medical appointments, enriching activities and opportunities for socialization, and monitoring and support of their physical and emotional needs and well-being. Not one of these 11 residents would survive on their own. Technically, it's called failure to thrive. I call it failure to live. But for argument's sake, if they could have an apartment, which they could be able to do, the cost to provide home services, one way or another, would end up costing the state by far more than $45 a day. So, on a personal note, for the life of me, I just don't understand why, when we're struggling for money, would we decide to go to the poorest, most vulnerable, defenseless people in our society. On behalf of these frail elderly citizens, I ask you to reject proposed legislation. Something I would like to add with some of the questions that came up earlier, such as, personally, I don't understand how the state is computing why it's not being covered by Maine Care unless a certain deductible is met. It is very confusing. What I do know, and I've been doing this for a long time, is that when an individual applies to the HHS for Medicaid, Maine Care, for residential care, there's an asset test. And the asset is they have to have under $10,000. It used to be $2,000, and it was raised to $10,000. So I urge you to find out more information how this whole thing is being computed, and I'm not saying it's not correct. I certainly don't understand it, but I think it would be very important for you to all have a very detailed understanding of it before you make any decisions. Thank you.
Thank you very much for being here. No questions. Sir, would you be willing to submit your testimony in writing?
I would. I think I...
It doesn't have to be today.
Okay, yes.
Apply it to our clerk sometime this week. I think it would be helpful.
Absolutely.
Thank you so much.
Thank you.
Thank you for being here and for your testimony. Lori Kane Lewis.